Hi, this is Jeff Waldberg at Ortho Pro Physical Therapy in the Runner's Clinic, and today we're going to talk about hamstring injuries. While in sprinters, hamstring injuries can involve actual tears of the muscles. In middle distance and longer distance runners, they usually involve strains where they're more microscopic injuries to the muscles. The locations can be one of two places. The one area that hamstring injuries occurs is right here where the muscle originates from. It's a little bit more of a tendinous area, and it's a bone that we sit on when we sit in a chair. This is not a good place to have this injury because as it is a tendon, its blood flow is not as good as when the injury occurs lower down in the muscle. The other problem with having the injury here at the origin is that whenever we do sit, it can bother the injury and actually irritate it. So it's a longer lasting injury, usually when the hamstring origin is high. If, however, the hamstring injury is lower in more the meaty muscle belly, it's a much better place to have it for several reasons. Number one, it won't bother you when you sit. Number two, the circulation to the muscular part of that region of the hamstring is much better, so therefore it should heal faster. And number three, in that area, we can even use a wrap or an ace bandage to give it a little compression and sometimes make it feel a little bit better. The causes for hamstring injuries are almost always speed. Anytime I've had somebody come in with a hamstring injury, my first question is, have you been doing any speed work lately? And the answer almost 100% of the time is yes. So speed can be relative. It can involve going to a track, speeding up your pace on a treadmill, or even just running downhill faster. So watch for the speed. The treatments that we use here are typically ultrasound and massage. Ultrasound to improve the circulation and the healing, and massage to not only reduce the muscle guarding and spasm, but massage has been found as a very useful tool in increasing the healing process in general. Very important changes that we make to the running is we try to make sure that there is not a delay in the takeoff. The longer a runner waits before they remove that leg from the ground, the greater the strain is going to be on that hamstring. And another way that you can think about it is with cadence, or the number of foot strikes. If someone is running with a slow cadence and very few foot strikes per given time, let's say per minute, versus running at a faster cadence, not necessarily speed, it's going to make the workload on the hamstring a little bit easier. The muscle contracts more easily when it's closer to the center of gravity than when it's further away from the center of gravity. So hopefully some of these changes are things that you can make, but if we can help you, just let us know. Good luck with your injury, and happy running.